So I'll walk into the room, I'll introduce myself, wash my hands, I'll put gloves on, and then I will look at the baby's bands and also the mothers to make sure that it is their baby and that I am assessing the right baby. And then I'm just going to explain to the family that I'm going to be doing an assessment of their newborn. So to start, I will grab a set of the baby's vitals. I will count the baby's respirations, and normal is 30 to 60 breaths a minute. And then while I do that, I'm going to listen to the baby's lung sounds and make sure that there's no adventitious lung sounds going on and that the lung sounds are clear. And then I'll watch the baby's chest movements, make sure it's equal and symmetrical, and that there's no retractions going on. Then after listening to the lung sounds, I will listen to the baby's heart and listen for any murmurs, and then I'll listen to the apical pulse for a full minute to make sure that I get an accurate heart rate of the baby. Okay, and then I will make sure the baby's color is good and that there's no central cyanosis going on, and I'll check for any edema, and if there's acrocyanosis, that's okay. That's a normal finding in newborns where they're cyanotic on the hands and feet. And then I would be using a pediatric stethoscope. And then after I have listened to the heart and lungs, I can take the baby's temperature. I will do it the axillary route, so I'll stick the thermometer in the center of the baby's armpit and then hold their arm down until the thermometer beeps or until it gets a reading. Okay, and then I'm just going to assess the baby's head. I'm going to palpate for his anterior fontanelle and posterior fontanelle, and I'm going to make sure that they're not bulging or sunken. And then I can also assess if there's any molding or caput going on that was a result of the birthing process. And I'll make sure that the baby can move his head freely and that there's no clubbing going on in the neck. And I'm going to then measure the baby's head circumference. So stick it underneath, and then I'll just go around right above the ear line like that to get his circumference. And okay, and then I will make sure the baby's eyes are symmetrical and the nose looks good, and I'll assess the baby's pupils by seeing if they are round and equal and reactive to light and accommodation. And then I'll assess the patency of the baby's nostrils by plugging one at a time, because babies are nose breathers, so I have to make sure that they can breathe through their nose. And then I will look inside the baby's mouth and make sure the baby's tongue can move freely, and assessing like their palate, their hard palate, and for any Epstein pearls. And then I can also assess the baby's sucking reflex by putting my finger in the baby's mouth, and then I will palpate the baby's clavicles, make sure they weren't broken or damaged during the birthing process, and then make sure the baby's nipples are even and symmetrical. And I'll also get a measure of the baby's chest circumference. So, if I can. So I'll measure it by going right around the nipple line, like that. And Harrison can almost support his neck, so I would be sure to always support the neck of the newborn if I'm moving them around. And then I can assess their grasp reflex by putting my finger in their hand and then grabbing it, and their plantar reflex, so grasping my hand with their toes, the Babinski, so their toes fan out, and then the rooting reflex, so they will turn to the side of the touch side, and then the moral reflex, which is the startle reflex, so the baby's arms and legs will fan out. And then I'll make sure the baby has adequate range of motion in their extremities and good muscle tone. And then I'll assess if the baby's hips click, because that would be an abnormal finding. And then I'll make sure that I'll assess the peri area, and if there's any swelling in the males, which is sometimes a normal finding, or if there's that cheesy white discharge in the female, that can be a normal finding too. And then I will listen to the baby's abdomen in all 4 quadrants. For bowel sounds, and I'll make sure their abdomen is soft and round. And I will also be looking at the baby's umbilical cord, making sure that it is dry and it's clean, and making sure that the diaper isn't rubbing on it or anything. And then after that, then I'll take the baby's weight. I'll place him on the scale, but first I will weigh the baby's diaper, or change it if it is soiled, and I'll ask the mom and dad if the baby has had any bowel movements or has voided, and because we want to make sure that before they go home they have a bowel movement to ensure that they have a perforate anus. And so then I'll weigh the diaper, and then I'll zero out my scale, weigh the diaper, then I'll weigh the baby with the diaper, and I'll subtract the weight of the diaper from the weight of the baby, and I'll make sure to get it in grams for my provider, and then in pounds and ounces for the parents. Okay, and then I'm going to flip my baby over. And while supporting my newborn's neck won't be as strong as this, but I'll support my newborn's neck with this hand underneath, and I'll assess the baby's spine, making sure that it's straight and there's no gaps. And I'll also assess the baby's gluteal folds, making sure they are symmetrical. And then I'll also assess the stepping reflex. You kind of like this one. And then after that, then I will measure my baby's length. So starting with right at the head, and then going down to the bottom of the foot with the baby's leg extended. The baby will let me. but I'll use the hospital's length measure. That would be a lot easier. Okay, and then after that, then I will document my findings.